as I was telling before, the neutrophilus account. And this is possible working with cytobrush or cytoflashing or cytotape. Well, of course, this technique is considered from many of us like the gold standard. Personally, I disagree this point of view. I don't believe that we can consider the count of the neutrophilus the gold standard, in particular for two reasons. First of all, because there is not a totally according between the different researchers, different scientists about the cutoff that we have to consider like the gold standard cutoff. The other point is that this type of evaluation is in relation with the techniques that we are using. For example, cytobrush is more accurate with respect to cytoflashing, in particular because with the cytoflashing, sometimes it's not possible to recover the fluid. In other cases, we have more damage of the cells, and it's necessary a centrifugation of the sample that we are doing. The other point is that this type of exam is not an exam that we can do in real time, but require the use of the quick dip, colors, and so is necessary a microscope. We have to account the different field with a McMaster camera to see how many neutrophils are present. So at the end, require time, require equipment. That is something that permits me to tell that it is a good method for individual evaluation of the animal with suspected subclinical endometritis, so to confirm a diagnosis of clinical endometritis, but it is not a good method to do a herd evaluation of the subclinical endometritis. At the same time, in recent years, has been proposed also the use of the strips, but also about this method, we have to tell that the accuracy is not wide, and for this reason, this type of method necessary still some work to improve the accuracy. So it's like a work in progress. Well, the strips are based on the determination of leukocyte esterases, but I repeat, it's something that is a work in progress. At the same time, I believe that ultrasonography can be used for an ultrasound diagnosis. It is a very good method, the ultrasound diagnosis of the subclinical endometritis. Well, what I would like to propose today is to show that with an ultra-portable unit or a portable unit ultrasound scanner, it's possible to do this type of diagnosis. And so I would like to share with you some pictures, some clips, where I show what is possible to do in field condition. Of course, I repeat, the scientific community is a little bit skeptical about the ultrasonography, but for the only reason that never until now proposed the evidence of this method as a good method to do this type of diagnosis. Well, my idea today is to show you that it's possible to do this type of diagnosis in real time, also with ultra-portable units, so units that are absolutely very, very easy to use. You can work with Google, or we can use directly the evaluation inside the screen. In particular, in these pictures, you are looking at transversal section of the last third of the uterus of a cow, 37 days postpartum, 37 days in milk, with a subclinical endometritis. So it was a cow that wasn't without vaginal discharge, but without also purulent or mucopurulent material in the cranial part of the vagina. And you can see that we have myometrium, externally endometrium. The endometrium is thicker, and we can see the dilated vessels that are represented by the black holes. But above all, we have blister material inside to the uterus. Well, to do this type of diagnosis, it is not necessary very special equipment, ultrasound equipment. We can do it with sector probe, with linear probe, with a curve probe, with a frequency between 5 and 10 megahertz. The major part of us are working with linear or curvilinear probes with a frequency between 5 and 7.5 megahertz. And this type of exam requires, I repeat, few minutes. And we are speaking of equipment that can be portable or ultra portable. So we are speaking of equipment that have a weight between 800 grams until 2,800 grams. Well, in 2008, Ballon and Palmer proposed a strategy for to do ultrasound diagnosis of the subclinical endometritis, and they proposed to use two parameters: the thickness of the wall of the endometrium and the thickness of the continents inside to the uterus. Well, they proposed this, telling that when that could be possible to speak of subclinical endometritis if there was a thicker endometrium over 8 millimeters, and the continent, uterus continent was more than 3 millimeters. However, if we use this type of parameters, we can conclude that there are a lot of untrue positives. So what means? That the specificity is very good of this method, working with the parameters on Palmer. So the negative cows are negative, but the sensitivity is very, very poor because we have a lot of number of untrue positive. What means? That we have all the cows that have an estrogenic profile, that have a thicker endometrium and a thicker intrauterus continent, more than 3 millimeters. So at the end, I'm showing here longitudinally cross section of the uterus, a uterus in follicular phase, probably during the last part of the proestrus. In fact, we see that we have a contracted myometrium, and the contracted myometrium is possible to see that it is also echoic. Then we have the thicker vascular tonica, and we have a thicker endometrium because we have an edema. And inside the endometrium, we can see a lot of blood vessels dilated that appear anechoic. But above all, you see that the difference in echogenicity between the myometrium and endometrium is clear. So the myometrium is echoic and the endometrium is hypoechogenic because it's full of blood, and the blood-like fluid absorbs the ultrasound. Then we have also the continent of the uterus that is improved. You can see that we have a lot of fluid, but it's fluid that is absolutely anechoic. And another particularity is the presence of specular reflection. The specular reflection are special artifact that we can find inside to the uterus. Another point here is a oblique transversal section of the uterus in the same moment. So you see that we are looking at the specular reflection that are parallel between them, but are independent from the profile of the endometrium, of the epithelium of the endometrium. And the other point is that you can see that the myometrium is contracted, and in particularly in these pictures, you see the difference in echogenicity of the myometrium and the endometrium. So the myometrium appear echoic, white, while the endometrium appear hypoechogenic, so more dark. Well, in these pictures, in the next pictures, now you are looking at a transversal section of a cow in it. Well, in this case, you are looking that the contraction of the myometrium and the thicker endometrium are very, very evident. And it's very evident also the vascular tonica that is increased in size. But it's different also the echogenicity. So the myometrium is echogenic, and the endometrium is hypoechogenic. But what is interesting in this case is also to see the shape of the lumen of the uterus, that in this case is a star image shape. In other case, you can see, in particularly in longitudinal section, you can see that the shape is like a Christmas tree. Well, the situation that we are described in the last minutes is of a cow during the proestrus and estrus, so in the follicular phase. But attention, you have similar pictures also during the first 36, 48 hours of the metaestrus. So we are still in luteal phase. We are in the first 2 days of the luteal phase. We are in metaestrus, and despite that we consider luteal phase with progesterone profile, during the first 48 hours of the metaestrus, the level of the progesterone is less than 0.2, 0.3 nanogram, and we have still a little bit of estrogens of the last cycle. And this is fundamental because thanks to this estrogen level, we have a pulsatility of the LH who permit the luteinization of the graft follicle, and with the conversion of the theca cell in the small luteal cell and the granulosa cell in the big luteal cell, so develop the hemorrhagic body. Well, if now we analyze a cause with a subclinical endometritis, this is an excellent picture of a transversal section of a cow of 42 days in milk, without vaginal discharge, without any purulent or mucopurulent material inside the uterus. This cow was a regular cow analyzed just before the end of voluntary waiting period to decide if introduced or not in a pre-synchronization program. And I was looking that in the last third of the uterus there was material. And well, you can see that with my portable unit, I am looking that there is an inflammation inside the uterus. So independent from the concept of evidence or scientific evidence, you can see that is obviously for everyone, for every sonographer, to distinguish this like a subclinical endometritis. But also in this case is, if it's possible, more clear than the last one. You see an oblique transversal section of the uterus. In this case, you see that the continent is very dense, the continent of the uterus. You see that is very dense, is echogenic, and is producing a very typical artifact that are the shadow. In this case, is a very thin shadow that depends that the continent of the uterus is very dense and is producing a quite totally reflection of the ultrasound. And so you have this shadow. Well, in this case, I'm not interested to take the measurement of the endometrium or the contents of the uterus, because it's clear that we have an inflammation, a chronic inflammation of the uterus. But just to be clear, you see that in this case we have effectively a thicker endometrium. So in this case, we have a thicker endometrium, and also there is more than 3 millimeters of continent inside the uterus. But this is the case. Sometimes we have less than 3 millimeters. But it is not are not these two parameters that I use to do this type of diagnosis. Well, I was telling you before that sometimes the continent of the uterus is so ecodense could determine a totally reflection. And so in this case, you can see in these pictures, we have a very, very strong shadow. And well, this means that the continent inside the uterus have a density, ecodensity that is very high. So it's pus with a very, very low quantity of fluid. Well, so at the end, you can see that I am sharing different pictures of subclinical endometritis. You see that in subclinical endometritis, we have not specular reflection, the artifact specular reflection, but we have another typology of artifact that are the shadow. So this is the first take-home message. Independent from the thickness of the endometrium, independent from the thickness of the lumen of the uterus, so the quantity of continents inside the lumen, we can do this type of diagnosis evaluating, for example, the different artifacts that you can find. So every time that we are in follicular phase, every time that we are during the first 36, 48 hours of the metaestrus. So when we have an estrogenic profile or still presence of estrogens, Well, the characteristic of the uterus are typically of the estrogenic profile: contraction of the myometrium, thicker endometrium, thicker vascular tonica, typically Christmas tree image of the lumen of the uterus, or Christmas or star image. Well, and we have specular reflection. All the times that we have a subclinical endometritis, in this case, we have not specular reflection, but normally we have a shadow. And independent from the presence of the shadow, because sometimes we have inflammation without too much echo density of the continent, it's possible to see that this material is following the profile of the endometrium. Look now, a cow in it. So you see that the ultrasound pictures is totally different. So you see that we have specular reflection, and the specular reflection are not following the endometrial profile, but are parallel between them, but independent from the profile of the endometrium. And of course, you see that there is contraction of the myometrium. We have dilatation of the endometrium, thicker vascular tonica. So when I see these features, I try to confirm my suspicions of follicular phase, analyzing the follicular map. And so probably I will find one graph follicles and one or two other dominant follicle in atresia, and in function that the cow is 2 or 3 follicular waves. Well, sometimes can happen that we have cow in it, and at the same time, this cow in it have also a subclinical endometritis. This happens we are doing just before the artificial insemination. We are doing the rectal palpation. We are removing the fecal matter. In doing it, we produce a stimulation of the uterus, go outside from the vagina, the mucus, and inside to the mucus we can find white points. Well, in this case, we have the cow in it with also a subclinical endometritis. Well, in this case, the ultrasound image is exactly what you are looking on the left, in the picture on the left. The picture on the right is a cow in it, but you see a cow in it on the left where there is also a subclinical endometritis. You can see that there are sometimes specular reflection, not so much, and very, very short. And this depending because there is a blizzard continent inside to the uterus. So the specular reflection are possible only if between the two parallel surfaces of the endometrium there is any fibrin or any neutrophilus. In this case, you see that there are a lot of blizzard, snowstorm effect, and the specular reflection are only few. Well, so at the end, when I see this image, I know that this cow is in it, or is coming in it, or is immediately after the ovulation. So when I see that there is a star image shape of the lumen of the uterus, or a Christmas tree image, I know that we are under an estrogen profile. Well, now I want to show you a movies where you are looking at cow in it, and not only in it, but with in the last third, in the cranial third of the uterus, you can see an endometritis. Well, with the palpation or also with sonography without attention, to discover this subclinical endometritis, it was impossible and or very difficult if the sonographer is not a little bit smart. But with the palpation, it is impossible to do this type of diagnosis. Doing this type, in this type of cows, doing insemination, probably the conception rate will be very, very low. So to see this type of inflammation permits me to tell to the owner of the cows that it's much better to avoid the insemination, doing a prostaglandin after 10 days, or doing an insemination and then after 12-24 hours, introducing inside to the uterus cefapurine, or in some other cases don't do the insemination and do a flushing with PBS or physiological serum, or eventually to do a flushing with a low irritant solution, for example, 2%, 3% Lugol solution, and after 10 days doing a prostaglandin, doing the insemination when the how after the prostaglandin will show the it. But look these movies, and it's very interesting to see that we have a lot of fluid, dilatation of the endometrium, contraction of the myometrium. Here you're looking at a blood vessel of the broad ligament. We have seen now specular reflection, ovaries with the follicles, and now you are looking that there is the last third, we have seen the last third of a transversal section of the uterus, last third of the uterine horn, and there was that the endometrial profile was absolutely surrounded by a very thin echoic line. And in the next picture, you will see it very, very well. Here is. And you see that there is a part of the uterus without inflammation and the last third with the inflammation. In this case, the white line is following perfectly the surface of the endometrium. And in case of specular reflection, you see that this not happen, but we have that the specular reflection are parallel between them, and they are independent from the profile of the endometrium. Well, I want now to introduce a special typology of subclinical endometritis, the pyometra and the mucometra. Well, I want to do a premise. The pyometra, ultrasonographically, is very similar or is the same to clinical endometritis with purulent or mucopurulent endometritis. So we have blizzard, continent of the uterus, no storm effect. So ultrasonographically, they have the same characteristics, but I speak of clinical endometritis when I am before the end of voluntary waiting period, while I speak of pyometra normally at the end of voluntary waiting period or after the end of voluntary waiting period. Well, the characteristic of the pyometra is that I have two of the three conditions for to tell that the cow is pregnant. So I have the corpus luteum, because in many of these pyometra we have a persistent CL, and this persistent CL is the term that the cervix is closed. So the major part of the pyometra are closed. So we have not an open pyometra, so a clinical endometritis with purulent, mucopurulent material outside of the vagina. The persistent CL is responsible that the pyometra is can be included in subclinical endometritis. The reason why I develop a persistent CL is very simple. So we have the damage of the epithelium of the endometrium, so the first layer of the endometrium, and so we have an exposition of the stroma. And the stroma cell of the endometrium are producing special prostaglandin that is PGE2. This prostaglandin respects the prostaglandin PGF2 alpha produced by the epithelium cell of the endometrium, is not luteolytic, but is luteotrophic. So what is doing is improving the vascularization of the corpus luteum. So we have an hypertrophy of the corpus luteum, and so instead of to disappear, stay. So we have a permanence of this corpus luteum for some weeks or sometimes months, and if we don't do a prostaglandin. So we have a cow that is an hystrus type 4, is the only form of an hystrus with a corpus luteum. It's very interesting also how the prostaglandin is going outside from the uterus, because the prostaglandin is produced from this prostaglandin is produced by the stroma cell and go outside of the uterus with the uterus vein. That outside of the uterus is surrounded from different branches of the ovary arteries. So there is a transfer from the vein to the arteries of the prostaglandin, and this prostaglandin can improve the corpus luteum blood flow. And for this reason, we have the permanence of this corpus luteum. Well, what is interesting with pyometra is that with the palpation, in particular in those farms where I don't know if the cow is being inseminated and when, for example, because we have the bull inside to the herd, I can confuse this with a palpation for a cow pregnant, but it is not pregnant. And you can see that ultrasonographically we have purulent, mucopurulent material inside. Normally the pus is free of move inside to the uterus, and the quantity sometimes is few ml, but we can find pyometra with 500 ml until 2 or 3,000 ml or more. And this is very, very interesting because the quantity of pus is variable. It's not, it's depending from the situation, for the level of the infection, from the drainage through the cervix. Well, I was telling that normally the pus is free, and then we have always in the major part of the cases the persistency of CL, but in some cases, like here, there were 2 persistent CL. In some rare cases, the pus is not free inside the uterus, but is covered, is an envelope, and you have like a ball that is moving inside the uterus. Well, there is any problem, also in this case, the therapy is always the same. We work with prostaglandin. In particular, we are speaking of cows with pyometra. We are outside of voluntary waiting period. So there are different strategies to treat this animal. My personal strategy, I'm not interested to treat the pyometra. I want to get pregnant the cows with pyometra. So for this reason, my first choice in this case is to do a pre-cinch of cinch. So in this 35 days or 38, depends if you are working with pre-cinch of cinch 11 or 14, the cow coming in heat 3 times. And every time the cow is coming in heat, they improve the level of the estrogens. The estrogens, we have to remember that are chemiostatic, so they call a lot of neutrophils inside the uterus. They improve the drainage of the material inside the uterus thanks to the production of PGF2 alpha through the oxytocin link. And then they improve the production of antibody inside the uterus, but not only, also of a natural bactericide substance like lysozyme lactoferrin. So every time that a cow is coming in heat, there is a therapeutical effect. For this reason, I'm not interested in this case, after that I have done a confirmation of the diagnosis by ultrasonography, to do, a treatment with flushing of the uterus or introducing cefapyrin or other antibiotics inside to the uterus. Well, similar to the pyometra, the mucometra. Well, about mucometra, we have to tell that in this case we have still 2 of the 3 conditions for to speak of pregnant cows. But in particularly in case of mucometra, the presence of fluid that is perfectly anechoic, the presence of the persistent CL, well, is create a condition, an ultrasound condition that is very, very similar to a cow that is pregnant. The only difference is that in this case there is no the embryo and or the fetus. Honestly, we have to tell that there are also some other small signals that permit me to distinguish between a mucometra and a cow that is pregnant, independent from the presence of the corpus luteum and the fluid that are anechoic, because in particularly looking close to the endometrium, it's possible to see that we have often, in case of mucometra, hyperreflection. We have some rain reflection. So we have this typically rain artifact that is an hyperreflection, and we have also an edema of the endometrium, so we can see that there is an inflammation of the endometrium. Honestly, about the prognosis of the mucometra after the diagnosis by ultrasound, we have to distinguish between a true mucometra and where there is an hyperplasia of the glandular system of the endometrium, so we have an hyperproduction of mucus, and not only a persistent CL who determine that the cervix is closed. In this case, the prognosis is not good because we do a prostaglandin, we have the drainage of the mucus, but after a few days there is still mucus inside to the uterus. So in this case, the true problem is the hyperplasia of the glandular system of the endometrium. But the major part, more than 99% of the cases, is a mucometra, that is the term to an accumulation of mucus inside to the uterus, only because there is production of progesterone from the corpus luteum, persistent CL for the chronic endometritis, and in this case we have that the cervix is closed. Normally, also in this case, introducing these cows in a pre-cinch or cinch program, we have a very good chance to get pregnant these cows. Normally, the conception rate with the pre-cinch or cinch for cows with pyometra or mucometra is similar to the cows that are being introduced in the pre-cinch or cinch program without endometritis. But we have to remember that in case of cows that are introduced in the pre-cinch or cinch with inflammation of the uterus, the embryonic death, the later embryonic death, so the gestational losses between 30 and 60 days of gestation is 2-3 points higher. Well, we are arrived at the end of this presentation, of this seminar. I hope that has been useful to share this image and to share these clips to understand and to convince everyone that it's possible to do this type of diagnosis of clinical endometritis, also working by ultrasound, and in particular with ultra-portable and portable ultrasound scanner. My conclusion is that, honestly, I don't believe that there is any gold standard for the diagnosis of subclinical endometritis. So I am not telling that the gold standard is ultrasound, but I am sure that also it is not the gold standard. The cytology is a fantastic method to do individual diagnosis, but it is not useful to do herd diagnosis and for monitoring a group of animals during the postpartum. Require time. It is not a real-time exam. Require some tools, and so honestly, I believe that is something that we can use, but only for individual evaluation. The other point is that, well, it's possible to do a evaluation of by ultrasound of the subclinical endometritis, but it is not convenient to do it basing the diagnosis on the thickness of the endometrium and the thickness of the lumen, because in this case we have a lot of untrue positive. So all the cows with an estrogenic profile respect these 2 points. So we have a thicker endometrium and a thicker lumen. Ultrasound diagnosis by ultrasonography, ultrasound diagnosis of subclinical endometritis, who instead of to take the thickness of the endometrium and the thickness of the lumen, consider, for example, the presence of specular reflection, the presence of shadow, analyze the material inside the uterus, is very, very useful. And we can do a diagnosis excluding all the cows that have an estrogenic profile. And the cows with an estrogenic profile are cows that I can distinguish between the cows with inflammation, because we have contracted myometrium that will appear echogenic. I have a thicker vascular tonica. I have edema of the endometrium that will appear hypoechogenic. And I have a star image or Christmas tree image of the uterus. In particular, we have the fluid that's totally anechoic. While in case of clinical endometritis, we have seen that it's possible to find a thicker endometrium. There is also fluid inside the uterus, but normally it's blizzard. So it's like a snowstorm exit. And also in case we have cow in it with clinical endometritis, we have seen that it's possible to distinguish and to do this type of diagnosis, because normally the material inside the uterus is following the profile of the endometrium, while if the cow is in it, only in it, without inflammation, we have only specular reflection that are parallel between them, but without following the endometrial profile. So I agree, the critics that I receive constantly from some colleagues, other colleagues from university, or also some practitioners, when I try to convince, but in reality I want to show only my experience. I show my data, I show my my pictures, my clips, like today, showing that it's possible to do a diagnosis of clinical endometritis. Yes, of course, until that we have not a scientific validation, so it's necessary to do a trial showing that there is any difference about the precision of diagnosis if we use cytology with respect to ultrasonography. But the ultrasonography gives me this type of information in real time. So now I am personally working, trying to show this evidence. So I hope for the next year to edit this trial. So at the end, probably will be possible also to demonstrate with the scientific evidence, thanks to the trial, that the precision of the ultrasonography for to do diagnosis of subclinical endometritis is very high. Thank you very much for your attention, and I want to thanks again EMV Imaging for giving me the opportunity to stay with you today, and I hope to be able to answer your question.
Thank you, Dr. Giovanni, for a fantastic presentation, and we can now take your questions.